Tanya, Ednan-Laperouse and Emma Turay have told Steve Barclay that their daughters' deaths were entirely preventable and urged the government to appoint a leader to act as a champion for people with allergies. Sejal Karia has our report.
Two mothers sharing the same grief and the same goal after losing both their teenage daughters to severe allergic reactions. Natasha Ednan-Laperouse was 15 when she died after suffering an allergic reaction to sesame seeds in a pret-a-manger baguette. 18-year-old Turay Thomas also died of anaphylaxis after accidentally eating food containing a hazelnut. A coroner ruled she died in part because of human error, meaning it took an ambulance crew more than 40 minutes to arrive at her home. Deaths their mums say needn't have happened. They're now calling on the government to take action to prevent similar tragedies.
We are trying to get an allergy tsar to help the community, to make sure that we've got more specialist clinics and to make sure that we've got more training, more allergy specialists and mandatory training for people.
At the moment, if you have an allergy, a serious allergy, you fend for yourself pretty much, and that's what needs to change. It's so difficult for families just to get a diagnosis quite often.
1 in 3 people in the UK have an allergy. That's over 20 million people. Of these, 2 million have a food allergy, numbers that are set to rise sharply in the next 40 years. Around 2% of all children suffer from an allergy to peanuts. And in the last 20 years, hospital admissions have trebled for food-induced anaphylaxis.
It really is a postcode lottery, depending on where you live in the country, whether you will get the care plan and the sufficient care that you need.
Scientists are saying that by 2060, 70% of the population will be food allergic. Unless they actually start dealing with this situation and see it as a real risk for the public, it's going to be like a tsunami coming and it'll be too late. They need to start acting now.
The government says specialist services exist, led by NHS England. Tanya and Emma say they don't go far enough. Sejal Karia, ITV News.